The Gauteng Health Department will be visiting the family of a grade 1 pupil who died after consuming snacks apparently bought from a spaza shop in Ekurhuleni. The 6-year-old from the Mandletu Primary School being declared dead by paramedics after she started vomiting in class. Now, currently 4 other children aged between 2 and 9 years of age are recovering at the Polosong Regional Hospital in Tsakane after they were admitted following suspected food poisoning. Gauteng has recorded some 861 incidents of food-borne poisonings, which have resulted in 11 deaths since October of last year. Let's get you some analysis of exactly what's going on here. Toxicologist Dr Gerhard Verdoorn joins us this morning. Doc, it's great to have you with us on the program. What do you make of these shocking and really just heartbreaking numbers?
Well, I was highly shocked last night when I heard about this news from you. And I do not buy the story fully that it is always food poisoning, because it's quite easy to point a finger at food poisoning. But I don't think that the authorities are following the due process and due protocol to find out exactly why people get the so-called food poisoning, especially when you get a young child dying, which is a devastating thing not only for the family but also for the country. So I want them to start digging deeper and doing some proper forensic analysis on the case to find out exactly what's going on in Gauteng, because it is not acceptable in a country like ours to have children dying from eating some food stuff.
Yeah. So Doc, I mean, there are a number of scenarios here, right? On the one hand, it may well be due to buying food from informal traders. Sure, that could certainly be part of the problem, but as you say, we need to do some proper forensic work to establish that. But I wonder whether you have also thought about the prospect that these children may have contracted a stomach bug. We know how detrimental, how threatening to life a stomach bug can be, right, because of the dehydration.
Well, I think most of us today have had food poisoning in one stage of our life. And I had it myself, and I know you feel like you're sitting on death's door. So it is a strong possibility, and there's a very strong possibility that when people buy food at spaza shops or on street corners with the street vendors, that the food will not be cleaned, the food will be contaminated by things like E. coli, salmonella, and those types of things. And for a young child in particular, they are much more vulnerable than an adult person with a much better immunity system towards these bugs than a young child would be. So food poisoning, depending on which bacterium will be present in the food, is a grave likelihood in the country. And unfortunately, our poor people are at the mercy of the vendors who don't keep sanity in their minds when they sell the foods on street corners or in some of the spaza shops. But my concern also lies a bit deeper in the fact that I've seen a massive surge in the quantity and the cases of people selling unlawful pesticides to the poor people, decanted into small containers and coming in from Zimbabwe. And my wonder is always, is this not perhaps a case of the food being contaminated with a pesticide poison that should not be in the hands of these people?
Yeah.
And that's why I say, and like you also said, we need to dig deeper into the deep forensics of what's going on with these cases.
Yeah, absolutely. It's bizarre that there's been this sudden surge of these cases, particularly in Gauteng. Almost 900 of these cases since October of last year. So what is that? October, November, December, in the space of 5 months. You know, the issue that you raise of pesticides is an important one, because if I am the owner of a spaza shop or I am an informal trader, I may well be using one or other pesticide to try and keep contaminants, ironically, to keep contaminants away, to try and make the food safer, right? That may well be the case. But surely then that would get onto the packaging of the food that I'm selling, and perhaps that could go some way in explaining how the children then come to ingest it?
Well, that's a possibility, but what is a more likely possibility that I consider nowadays is the fact that we see people buying a compound called dichlorphos, which is unlawfully decanted into small containers, and there are currently, that we know of, 76 syndicates selling it around the Gauteng and Limpopo province and a few in the Western Cape as well. And this particular chemical is like you can call it virtually a fumigant because it's got a high volatility. And if people sell it in their store, it will be volatile because they don't use the right containers. And if people take it home and they leave it there in the kitchen, for example, or they try and do fumigation for cockroaches, which is now our primary national plague, that chemical will contaminate the foodstuffs. And if a child or even an adult would ingest that food, it's going to be very, very serious poisoning. And there's a good chance of a mortality case if people ingest food which is contaminated by this dichlorphos chemical. On top of that, we also see a huge surge in the sales of the aldicarb, which is now been banned in the country since about 2016. And we also see turbifos being sold by every Tom, Dick and Harry to people out there, which they use as a rodenticide. So my worry is that we have the allegation of food poisoning. We haven't come to the bottom of it yet because we haven't identified the particular virus or the bacterium, or in the case of the chemicals, a particular active ingredient that caused this massive surge in cases in Gauteng. And if we don't get control over it, we're going to end up with thousands of people getting this, in inverted commas, food poisoning, and yet we don't know what it is at this stage.
Yeah, 5 months in, it is bizarre that we don't have more concrete answers to exactly what is causing the surge. But does the symptoms that we're seeing in children, Doc, does it line up with these illegal, what did you call them? Is it phosphates?
Organophosphates, organophosphate and some of the carbamate pesticides. So the symptoms, interestingly enough, the symptoms displayed by the children, and I only got scant information about this, but the symptoms displayed by the children gel very much with being exposed to an organophosphate or a carbamate pesticide at a sublethal dose, but it also gels then with a possible infection by a virulent bacterium like the Salmonella, Typhimurium, or maybe Escherichia coli or something like that. So that's why I say you have to get to the bottom of it because we don't know what it is. But the symptoms point to a poisoning. Now, whether the poisoning is because of a synthetic molecule like a pesticide or because of a natural bacterium, for example, we don't know. So there should be a very close collaboration between the medical doctors who are well qualified to diagnose the cases and the forensic investigation, the forensic toxicologists, and the pathologists play a very important role when they do the pathology on a mortality case to bring all information together to get to a solid answer that we can tell people this is what happened, that we can put mitigation measures in place, because I do not want to hear about this again in my life, that we see little children dying from things like these, and I call them things because we don't know what we're working with.
Yeah, absolutely. And to your knowledge, Dr. Verdoorn, is this issue of these syndicates operating and bringing these illegal pesticides into our country, has it been flagged as a matter of urgency, just to your knowledge of the situation?
Yeah, I do work very closely with the Department of Agriculture Input Control Inspectorate, and there's a young lady who does a lot of under investigations together with me, and we know exactly what's going on there. And the member companies of CropLife SA, who are the owners of the pesticides, have put stringent controls in to making sure that these chemicals do not get into the hands of these people. But we don't have any control over illegal immigrants coming across our borders and bringing these very toxic pesticides into the country as a form of currency. But we are working closely with authorities on this particular matter. And but it's become of such a magnitude that I'm not sure we're going to win the battle on this particular one. But we are working very hard with the state authorities to come to the bottom of this.
I suppose, just as a parting shot, one of the other issues that's also come up in our discussions around these cases of poisonings, and as you say, whatever they may be, is the issue of the lack of enough health inspectors insofar as these food outlets are concerned.
Yeah, well, if you think about a typical place where I live in Kleberga or Port Elizabeth, and the number of spaza shops here, I think it is an insurmountable task for the Department of Health and the inspectors at the municipal level to go to all of them and to do investigations. Now, when I go into those shops myself, I walk in there with gloves and with masks and stuff because it is absolutely filthy, that what you see on the places out there. And for us as a country to inspect, the little handful of inspectors from the Department of Health and Department of Agriculture is unjust because there are not enough people, they're under-resourced, and they are overworked, so they cannot bring this under control. So how are we going to overcome the problem? I honestly don't know the stage, but we are trying to do our level best from CropLife SA with the authorities to investigate and to at least put a damper on these spaza shops and the people that sell illegal pesticides. When it comes to food which is off-spec, then nothing that I can do about it, but we need to alert our public out there and our poorer people. Don't buy food which is off-spec because you stand a very good chance of getting some form of food poisoning and your children can die. And no one wants to see a child dying. So please don't buy off-spec food.